Hip flexor stretch, back to wall, pulses. The back to wall pulsing hip flexor stretch is a ballistic stretch that lengthens the anterior side of the hip. If you have tight hip flexors, or you're going to be performing hip extension movements in your training session, this is a useful stretch to use. Place one knee on a soft surface near a wall so the shin is at a 45-degree angle away from the wall. Set a strong posterior pelvic tilt, PPT, by contracting the glute of the rear leg and tucking the tailbone under. The rear foot must be aligned directly behind the glute of the rear leg. Often people with tight hip flexors will either shift the hip across or internally rotate the rear hip to move the foot out of alignment, because this reduces the stretch on the hip flexors. Aim to keep the hip square and the rear foot directly behind the rear glute. The further forward you place the front foot, the deeper the stretch will be. You want to find a distance that allows you to feel the stretch while keeping the back flat. The hands are placed on the knee of the front leg for two reasons. One, it creates a slight rotation in the torso, which helps to increase the stretch on the hip flexors. And two, it allows you to actively push down on the front knee, which will contract the abdominals and prevent the lower back from arching. Keeping the rear glute contracted, start to perform pulsing repetitions with the aim of sinking deeper and deeper into the stretch. If the stretch is easy, move the front foot further forward so that you can sink the hips lower to the floor. The back of the wall hip flexor stretch can be performed for pulsing repetitions, for isometric holds, or a combination of the two.